I love taking care of patients. You know, it's hard to meet someone their very first time in a position where they don't get to pick their surgeon. They don't know who you are, and you're going to be taking them to the operating room. It's a very vulnerable position to meet someone in. And so to be able to take that relationship and build from it, I think is it's a privilege that I have. It's a unique skill set that I like to maintain, to get that patient and their family through a really tumultuous time. So I really enjoy it. I love taking call and
you can tell. You can see the
that.
passion, both of you.
A sincere thank you to Wellstar North Fulton Medical Center for its sponsorship and for fostering a healthy community where businesses can thrive.
Welcome back to Brew Talks. I'm Steve Stroud. I'm president and CEO of Roswell, Inc. We're the economic development organization here in the city of Roswell.
And I'm Ashley Allen, VP of Operations. Today we have with us a couple of doctors from Wellstar North Fulton Hospital. We have Dr. Mamdani with cardio, and then we have Dr. Bhattacharya with ortho. And we're really excited to have you guys on today to talk about your specialties and just, you know, the crown jewel that it is to have a hospital in your city.
Thank you for having us. Really appreciate you having us here.
Well, I always say people that live here don't realize how important it is to have a hospital in your community. You know, in economic development, you see communities battle to get a hospital. And we've been blessed for 42 plus years, right, to have a hospital in Roswell, Georgia. That service was really a broader area. But as a Roswell native, to have that hospital here, have one of my daughters born there, have some surgery we talked about earlier, Quackenbush, where are you when I need you? But seriously, having it's part of our community. And what I was always brought up to believe is that your hospital was one of the stabilizing pieces too. You know, there was births, there were deaths, there were all kinds of things and good things that happened from a hospital. And so having you all here is just so important. And Wellstar has been such a great partner for the business community. And you're one of our leading employers. And that's, whether a lot of people know it or not, medical is the largest driver of economic development in the city of Roswell. Next is car sales, but I just wanted to let you know.
The backup career.
If all else fails, you go down Alpharetta Highway, and guess what happens? But anyway, we're glad to have you both here because two departments that are very distinct, and more importantly, as the hospital has grown, right, your services have grown. We're now starting to see these specialties are a part of Wellstar, not just a practice that feeds into the hospital. It's part of the Wellstar system. So let's start with ortho because I'm familiar with that. I don't personally. Not that I'm getting older, but I'm not ready for the heart thing
fair,
yet.
That's fair. That's fair.
Doesn't mean I wouldn't need it.
Yeah, right? Pick your poison between the two. Yeah. I'm the easier one to get.
So talk to us about the ortho program and really the department that you're a part of.
Yeah, I mean, especially as North Fulton, you know, being a level trauma center, Wellstar as an orthopedic department is relatively new in the community in Roswell. You know, there's been a lot of private practices that have been established for a long time, but we're newer to the game. But, you know, having a big trauma center to service, we've grown pretty exponentially over the past few years to be able to provide all the orthopedic subspecialties other than tumor to the community and to our patients so that we can kind of keep it all in-house. And it helps with collaboration, having all your physicians in one place, especially if you have, you know, shoulder issues to foot and ankle issues to joint replacements and things like that. You can get it all done at Wellstar. Makes a huge difference for our patients, you know.
Now, what I find interesting, so you just said from shoulder to hip to leg, you can do it all. Hand,
yeah.
And that's all done at North Fulton.
Correct. Yeah. So all of our providers have privileges at North Fulton. We do have all the subspecialties other than orthopedic oncology come in-house to North Fulton to do cases there. We have clinics at Upper Hembry in Roswell, but we also have clinics around the area in Alpharetta at the Avalon and other nearby locations to make it as accessible as possible for our patients that come from all directions.
How many doctors on that team?
As far as all of Wellstar Orthopedics, we have 40 plus. I think we're nearing about 50. But in Roswell itself, we have, I'd have to count, myself. I was going to say 5. So,
Still,
yeah.
Okay.
That's
So
a lot.
that encompasses, we got shoulder and elbow, we got sports,
Right.
we got trauma, we got hip and knee replacements, foot and ankle with myself. So
And you've got rehab too.
we have, yes, physical therapy in-house. Yeah. I don't know the physical medicine rehabilitation. There's inpatient physicians for sure at North Fulton that take care of
Right.
our rehab unit. So that makes it really nice as far as continuity of care for patients who have a hip fracture, go to North Fulton to be able to transition to their acute rehab unit, be taken care of there, and we can continue to follow them while they're in-house. So.
Which that rehab unit's been a key portion of the evolution of the hospital here in Roswell is having
Yeah.
that rehab unit.
Absolutely.
So
for
that's
sure.
pretty cool.
Yeah.
All right, let's talk about heart. It's still pounding. It's still good.
As long as it's still beating.
Oh, that's a good
Criteria
sign.
number
Yeah, but
one.
I when I read your the write up, it said blood pressure, high blood pressure, or tension. I'm like, now that could be some days. That truly could be
Spent
some days.
football Sunday.
Yes. Yeah.
So talk to us about the heart.
Yeah, so Wellstar cardiology actually is fairly new to in Roswell. It started in about, I think, 2014, 2015.
Oh, yeah, it is, yeah.
Although North Fulton has been a part of Roswell for a very, very long time, it wasn't acquired by Wellstar until fairly recently. So some of the physicians have kind of stayed on, and then some of us have joined in. So I was one of the new ones during COVID.
Oh, wow.
And that was a really interesting time to join.
Sure.
A lot of cardiovascular issues during COVID times. And since then, our practice has grown significantly. It used to be just 4 of us, and now it's 7 of us here now, just within the last few years, which is amazing. We see a lot of patients all throughout, from like 18-year-olds to, I think my oldest patient is 102 years old.
Wow.
Yeah.
Okay, I need to figure out what you're doing for their hearts to
Yeah.
keep them living that
I know.
long.
I
That
keep
is
asking them too.
secret.
I know,
need some
right?
of that
I'm
go-to.
like, what are you drinking? What are you eating? One patient, literally, I think it was a 100-year-old. Literally, only issue she had was like a valve issue, which is kind of okay,
Typical,
well,
right?
age related, right? And I was like, what do you do? She's like, believe it or not, the only thing I ever did in my entire life was drink a cup of milk every single morning. I'm like, I'm gonna do that.
Wow.
It can't hurt, I guess.
Yeah.
What an easy
That's
one.
what I'm saying.
I thought it was going to be like a glass of Chardonnay, and
Yep,
5
glass of
o'clock or
milk.
something. Wow.
Yeah.
I wouldn't have thought of that.
No.
Yeah.
Wow.
So we pretty much take care of everything from your run-of-the-mill high blood pressure, high cholesterol, chest pain, arrhythmias. The newer things that we're focusing more on are something called POTS, which is a part of autonomic dysfunction. Dr. Snapper is our guru for that. And then women's heart disease is something I personally love and focus on.
So talk to us, one of the series and areas that we're really been focusing on is women's leadership in business. And you two are doctors, and that says a lot, right? And you've got a new CEO that's a woman at the hospital, which I, with 3 daughters, a wife, and 2 dogs that are female, love the fact that you guys are in charge,
Yeah.
honestly, because I know it's going to get done right. Honestly, I'm a guy, all right, at the end of the day. Talk to us a little bit about what you're seeing at not just the hospital, but in your profession. I'm seeing more and more female doctors, which I think is great. For, again, you heard my reasoning. But I do think that that's really, really something that North Fulton should be proud of.
Yeah.
Just you two are
They're
examples.
doing a great job about it. Because I remember when I was first interviewing for Wellstar, and I hadn't moved here. I was still training up in Jersey.
Oh, wow.
And
Big change.
Yeah, big change.
Thanks for coming.
Yeah, of course. Thanks for having me here. Atlanta has welcomed me with open arms. Love being here. But yeah, so when I was first moved here, their biggest thing was there is no female cardiologist around this area. Wow. And we would love to kind of have that presence because women in general are underrepresented in not only in medicine, but also everywhere.
Right.
So it was kind of their first step in bringing a woman here to make sure that we're also kind of focusing on women-related issues because women's heart disease presents very, very differently than men's heart disease. And women's vascular, their arteries, their veins, everything is just very different.
Just different.
Just different. The whole physiology is different. So we present differently. A lot of times it's missed in women. Heart disease is very commonly missed in women. Even when it comes to CPR, women statistically are less likely to get CPR. And apparently that's because there's this fear of, of course, touching a woman inappropriately and getting in trouble for that. So people are afraid to do CPR. And I was surprised when I read that. If someone is, struggling and dying and you're afraid to give them CPR. But I feel like it's just because of lack of awareness.
No, exactly.
Education. And so I think that's what we need to do more, just spread that awareness, spread that knowledge.
Right.
And hopefully we can save more lives that way.
That's awesome.
Yeah.
So how many females on your team?
I actually do clinic over in East Cobb with Dr. Martinez, who's a Latino female, which is amazing.
Yes.
Wellstar's done a really good job of incorporating that dimension. You should have representation from all types of groups, and we really, truly do. And Dr. Burns, our chief, has really prioritized that. He just brought back one of the former Wellstar residents, Jennifer Blanda, who's a female. She's a sports trained over at Kennestone and also does some work over in Roswell too. So she's phenomenal. I mean, whatever walk of life you come from, I think patients want to see that their walk of life represented, their background and things like that. And I think having that diversity, especially in orthopedics, which is very male dominated, as I'm sure most people don't think of a short brown female when they go to an orthopedic surgeon, which, I hopefully over time will change. When I was training, I didn't see any women, especially women of color, during my training years. And so I think having somebody, that looks like me in the orthopedic department means a lot to not just the patients, but also to our trainees, the residents that we train, medical students that come through, and the future of medicine in general. So
it's awesome. So surgery, you said it earlier, so I'm going to repeat it because I thought it was a great line, and I'll just go with it that. Usually your customers don't talk back to you because they're asleep. And here we are having a dialogue. So I'm sure Quackenbush was glad I was asleep when he was working on my leg. I'm just saying. But at the end of the day, what kind of surgeries do you do?
Yeah, so my elective practice is foot and ankle. So I do the entire scope. There's a little bit of overlap with podiatry, but the training is completely different. So I'm orthopedic, foot and ankle. So I have a complete training in orthopedic surgery and then did an additional subspecialty year in foot and ankle. So that's my elective practice. On call, I take call at North Fulton Hospital, so I take care of whatever comes in the door.
You would have been doing me on Sunday night.
There you go. Rods, screws, nails.
Oh, yeah.
It. So that keeps it interesting. It keeps that skill set, part of it. And I love taking care of patients. It's hard to meet someone their very first time in a position where they don't get to pick their surgeon, they don't know who you are, and you're going to be taking them to the operating room. It's a very vulnerable position to meet someone in. And so to be able to take that relationship and build from it, I think is it's a privilege that I have. It's a unique skill set that I like to maintain to get that patient and their family through a really tumultuous time. So I really enjoy it. I love taking call and
you can tell. You can see the passion, both of you. So heart surgery.
I don't do any surgery.
You don't do any surgery?
Thankfully, no.
Okay.
She has to do the talking.
But I like doing the talking. That's right.
I know they do.
I like my patients awake.
Keep them awake. That's a good thing. Keep them going.
Let's keep chatting.
I actually get that. So do we do heart surgery at North Fulton yet? I know we've been talking about it for a long time.
Yeah, so we don't really do open heart surgeries just yet, but we do ablations.
Okay.
We do interventions, so stent placements, peripheral vascular procedures. If patients come in with pulmonary embolism, blood clots in their lungs, we do remove them. So all those things we do.
Okay.
The only procedure I do under anesthesia when patients are asleep is a TEE, where we go in and take a look at the heart from the inside, make sure there's no blood clots, things like that. But yeah.
Wow.
Yeah.
So where do you see both of your practices, real quick? I'll go back to orthopedic. How do you see it in the next 5 years in North Fulton?
Yeah, I mean, we're definitely expanding. I'm just procured some more block time at North Fulton, so I'm doing more surgeries over there. Part of it is that as you meet the demand, you kind of get more block time and stuff like that, so then I can meet the demand. And so that's continuing I'm relatively new to Wellstar. I joined about a year and some change ago, and so
welcome.
Yeah, thank you. I moved from Denver, so it's great to be here.
Go Broncos!
Yeah, there you go. But yeah, so slowly expanding at North Fulton for sure. We're bringing in more surgeons all the time. And so North Fulton's really prioritized orthopedics. We're opening up a surgery center over at Upper Hembry. That was open 1 to 2 days a week for orthopedics, ENT. The goal is to expand that to 4 to 5 days a week and potentially even talk about building a new surgery center over in Roswell. So the volume
here.
Yeah.
That we love. That
There
just
you
ring,
go.
ring.
The volume of surgeries that we can do locally for the community here is going to greatly increase, and hopefully, Wellstar becomes a forefront name in orthopedics very soon. So
That makes a lot of sense.
Yeah, it's great. It's great when people can get the care they need in their community.
Yeah.
100%.
And not have to travel down to Emory or, in town somewhere.
Yeah.
I think that's one of the key kind of attraction pieces
Right.
that we lean on the hospital for often when we're talking to CEOs of companies that are looking, is that we
It really
have
does make a difference.
a top-notch hospital right here in the community.
Well, and I again, I'm a proponent of Wellstar and especially North Fulton Hospital. And my thing is having the health parks, right?
Right.
Having Avalon, having East Cobb as a backup, right? So that you can get the services you need. It's even though it's in Cobb County for East Cobb, it's 5
Right
miles
next
from
door,
here.
yeah.
It's next door.
Yeah.
So, it's nice having all of the accessibility that we have for healthcare and not have to go in town, right? Which I think is amazing because that wasn't always the case,
Yeah.
right? And now we're getting, as you said, top-notch healthcare professionals like yourselves that are here taking care of our families. And I think when we're talking about recruiting a company from, we'll even say the Czech Republic most recently, which we did, that was one of their concerns. Georgia Tech was a concern, and the hospital and school system. So those 3 components were very, very key to their decision, because we've got great restaurants every place in the community around Metro's got great amenities, but having all of those this close,
Right.
you throw in the airport on top of that, and an international airport, you've got all the recipe. But the hospital is a big driver of decisions on not just Roswell, but all of North Fulton. So we see that on a regular. So before we end this thing, if you had one piece of advice on your side of the medical world, what piece of advice would you give to our audience about maintaining good health?
So make sure you're getting at least 150 minutes of aerobic exercise in moderate intensity every week. However you divide that, that's up to you. Eat your fruits and vegetables. I know you hear your parents say that from the day you
I
were
think I hear
born.
that,
Eat
yes.
your fruits and vegetables. So definitely do that. Lean meats. Try to limit red meats, fried foods, fast foods. It's something I tell my patients every single day. That comes from they come literally from all walks of life, from like preventative care to treatment after having a heart attack. This is the same advice I give them every single time. Just take care of yourself. You've only got one you. Prioritize yourself. Your family, everyone else will be taken care of if you first take care of yourself, because you can't take care of somebody else
That's
if you're
right.
not well yourself.
No, those are valid points.
Yeah.
I tell everyone, we don't prioritize a lot of time for ourselves as we get older. When we were kids, we had physical education, PE
Right.
class, or some sort of thing that you were scheduled into your day to do. And so I tell my patients to try to schedule back their PE class for them, which, it can be decades removed for a lot of people. But calf stretching, eccentric Achilles exercises, the down part of a calf raise, if you can do those things as maintenance, and our tendons don't have as much excursion as it used to as we get older. And so your bodies just don't recover as fast. I'm sure most people notice that. And you're just more predisposed to injury. So getting up and playing pickleball one day after sitting on the couch for 20 years definitely is
Not a good idea.
not a great idea without a little bit of a warm-up. So schedule back in your pee and do a little bit more warming up and cooling down.
Well, that's awesome.
And maybe drinking a glass of milk a day.
There
so
you
we
go.
can
Maybe
mention
I know.
that's
Let's
it.
throw that in.
The secret recipe to longevity.
That's a bonus. Well, thank you both for coming on Brew Talks. It's a pleasure to meet you both, but more importantly, we appreciate what you do for our community, because with you and Wellstar, who, by the way, sponsors this event, Brew Talks every week, we appreciate that. Thank you for all you do. We appreciate it.
Thank
So,
you.
as we always say, it's a great day to do business. It's a great day to stay healthy in Roswell. Raise your glass. Cheers.
Cheers to that.
Stay healthy.
Love it.